Well, thank you, Madam President. Madam President, I'd like to speak this morning following up on the wonderful comments made by the minority leader, specifically about the health care law and the ways that taxpayer dollars are now being wasted and spent in what appears to be, to me at least, a propaganda campaign by this administration to promote a health care law that the American people have, at least a majority of them, when asked about it, think should be found to be unconstitutional by the Supreme Court, and so many Americans want to see repealed and replaced. And Madam President, over 2 years ago, President Obama and Democrats in this very body and across the hall, the leaders in Congress jammed a health care law through Congress, and it was drafted completely behind closed doors. We all recall Nancy Pelosi famously saying at the time that first you have to pass it before you get to find out what's in it. And I've come to the floor week after week after that with a doctor's second opinion about the health care law to make sure the American people know what's in it. And week after week, there have been more things found out about the health care law that has made it even more unpopular today than it was at the time it was passed and signed into law by President Obama. Americans knew what they wanted. They did want health care reform. They wanted to be able to get the care they need from the doctor that they want at a price they can afford. And yet when I go to town hall meetings all across my home state of Wyoming and meetings in other communities, and you ask the question, do you think under the President's health care law you'll be paying more or less for your health care? The hands go up that they're going to be paying more. And then you ask them, do you think that the quality and availability of your care is going to go down under the health care law? And again, the hands go up. And that's not what Americans want, not to pay more and get less. But yet that is what the American people are receiving under this health care law. So I'll continue to deliver this second opinion on the Senate floor so we can continue to talk about what's going to be the impact on Americans' lives as a result of the health care law. Now, for over 2 years, the news about the law has not been good for those who support it, and the country has had opposition to the law continue to increase. Today, 56% of Americans oppose the President's health care law. You say, why is that? Well, there are a number of reasons. One is the health care law is adding to the national debt. We just heard the Republican leader talk about the incredible national debt that the American people are facing. The health care law has increased premiums that people have to pay for their own insurance directly as a result of the health care law being passed. The President promised if you like what you have, you can keep it, but it's actually the health care law has made it harder for workers to keep their employer-sponsored health care coverage. People want to have choices. They want to have patient-centered care, yet this health care law established an unprecedented board, unelected bureaucrats, who will, by their decisions, have a direct impact on whether patients can get to see a doctor, whether they can receive care. When you look at the incentives that are part of this health care law, the incentives actually, to me, appear to encourage employers to either fire workers or stop providing health care coverage. To me, this health care law is discouraging to students who otherwise might pursue a career in the medical field to provide care for Americans. And in my opinion, this is a law that has actually weakened, not strengthened Medicare. And it has done that by by taking $500 billion away from our seniors on Medicare, not to help strengthen Medicare, but to start a whole new government program for someone else. And the Medicare actuary came out with a report just last Friday to say when you actually get into a realistic assessment of the impact of this health care law on Medicare, it weakens it. It shows that Medicare going broke sooner than initially thought. And this report on an actual realistic look of the impact of the health care law on Medicare is it's going to make it that much harder for our seniors on Medicare to get the treatment that they need, to actually even get to see a doctor, to find someone to care for them because of the the implementation of this law, which takes $500 billion away from Medicare, not to strengthen or save Medicare, but to start a whole new government program for someone else. So I could go on and on with the legitimate complaints about the law. We've made it clear for over 2 years that the law is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and it's terrible for taxpayers. Well, this week we get a response to our long list of serious issues, and the response is from the Obama administration and members of the administration, and what they are doing is essentially doubling down on the president's failed law. Instead of addressing the serious concerns that the American people have about the law and about their own health care, the White House has somewhat come to a conclusion that they've actually done a bad job of educating the American people about the law. So now, just months before the presidential election, the 2012 election, the administration has just signed a $20 million contract, for a private PR firm to educate the American people about the law. Now, of course, this is taxpayer funded. So let me repeat, the Obama administration is not going to even acknowledge any of the real problems with the law. Instead, it's going to spend $20 million taxpayer dollars on press releases and more government propaganda. It's important to remember that this isn't the first time the White House has spent millions of taxpayer dollars on trying to spin this law. They realize it's unpopular, but are they addressing the fundamental flaws? No, they want to do more public relations. You know, in fact, this administration spent $700,000 on an advertisement starring Andy Griffith, the television star, about how the law will impact Medicare. And the Internal Revenue Service spent nearly $1 million in taxpayer funds to pay for 4 million postcards promoting tax credits within the law to small businesses. And of course, what we've seen is fewer and fewer small businesses than anticipated actually chose to take advantage, the president would say, I would say, found that they weren't able to qualify for the so-called benefits of the health care law. So what we've seen is the president's law continues to be unpopular, and now the administration chooses to spend taxpayer dollars to try a public relations campaign to make it more popular instead of dealing with the fundamental problems. So here we are millions of dollars later, and it is clear that the White House still hasn't learned what most Americans understand. Good policy is good communication. When a law is good, it sells itself. Americans immediately reap the rewards and appreciate what has been done. But when a law like this health care law is a bad one, there is no way that another slick PR campaign paid for with taxpayer dollars can make it look any better. The American people deserve real solutions to their health care problems, not more Washington spin. Yesterday, I called on the president to cancel this program immediately, to retain the taxpayer dollars, use it to pay off the debt, use it as part of the lowering the deficit. Don't send it to a PR firm to try to spin this law. We need to repeal this law. We need to repeal this health care law, replace it with a better plan. Instead of wasting millions of taxpayer dollars on this PR campaign, we need to go back to the drawing board. Americans deserve to be able to get the care they need from the doctor that they want at a price they can afford. That's what I'll continue to talk about on the Senate floor as I offer a doctor's second opinion about the significant failure of the law that passed the Senate, was crammed through the House, and was signed by President Obama 2 years ago. Thank you, Madam President. I yield the floor.